We start this hour with news of a new COVID-19 variant detected in South Africa. Scientists are describing it as the worst one yet. The country has now called for an urgent sitting of the World Health Organization Working Group on Virus Evolution on Friday. The scientists are concerned the strain's unusual mutations could make it more transmissible and possibly more resistant to current vaccines. At least 22 cases have been detected in South Africa. Cases have also been reported in Hong Kong and Botswana. No cases of the new variant from South Africa have been detected in the UK, but Britain is imposing travel restrictions on 6 African countries, including South Africa. The temporary flight ban comes into effect Friday, and British travellers returning from any of the 6 African countries will have to quarantine. Germany's single-day fatality rate is at a record high, with the death toll to date crossing 100,000. The country's been battling its most severe wave of infections since the start of the pandemic. The newly found coalition is expected to address the situation, and the new chancellor could make vaccines mandatory. The Czech president Milos Zeman has been readmitted to hospital after he tested positive for COVID-19. Meanwhile, in an effort to control the infection rate there, the government has ordered that bars and clubs close on evenings at 10. Christmas markets have also been banned for 30 days. Neighbouring Slovakia entered a 2-week lockdown on Thursday. Only essential shops and services can operate. Dr. Bharat Pankania is a senior clinical lecturer at University of Exeter Medical School. He joins us from Bath in the UK to talk about the new coronavirus strain detected in South Africa. Doctor, always a pleasure seeing you. Firstly, we're hearing words like horrific, heavily mutated, and worst variant to date. What more do you know about what's being called B11529?
So this is a mutation, and by mutation we mean changes in the makeup of the RNA that makes the virus. And with the changes in the RNA, it results in changes in the proteins that make up the spike protein. So for our listeners and viewers, what it means is many mutations equals a change, a potential change in the shape of the spike protein. And when that shape changes, other things follow. 1, it may be more infectious. 2, it may be less infectious. 3, it may be more disease causing. 4, it may be less disease causing. So these are the things that happen when there is a dramatic change in the shape of the virus.
Doctor, any information yet about how effective current vaccines are against this new variant?
We don't know, and it is best to reassure our viewers and listeners that no matter what, with respect to these wonderful mRNA vaccines from Pfizer, Moderna, AstraZeneca, Oxford, etc., if these viruses are vaccine bypassing, we can reformulate the vaccines and cover whatever is circulating with a new vaccine. So it wouldn't be a case of we need to panic. Of course, people who are already immunized may mount an immune response or may mount a slightly reduced immune response. As a clinician, my bet is that it will not be 100% vaccine bypassing. I doubt it very much. It may be maybe 5 to 10% or maybe 20% vaccine bypassing. But only time will tell us. They will be doing tests, they will be doing antibody tests, etc. And we will know in time how much damage this new variant does, if at all.
Doctor, you talked a bit about mutations, about those physical changes in the proteins, but why do they happen?
Good question. So these viruses are, we call RNA viruses. And these RNA viruses, when they multiply, they make mistakes because they haven't got a checking system. Therefore, if you have got somebody with HIV, for example, they are immune suppressed. And because they're immune suppressed, their infection lasts a lot longer. That means the virus is in their body multiplying mistake, as it multiplies for a prolonged period of time. And that is how many variants can emerge because of prolonged infection in somebody who is immune suppressed.
Dr. Pankania, your expertise is invaluable as usual. Thank you.